prepared to take notes because I'm going to tell you why your hospital or your patients or you as a nurse will benefit from this product. Okay? It was invented by a nurse, so just hear me out, okay? Your patients have a bed rail. It might not look like this. You put the head of the bed up, the bed rail goes like this. So what happens when you have all the stuff that like you toss over the bed rail? It sometimes slides off. Okay, so this is where the product comes in. I hope you're still taking notes. This is latex free, adhesive free, so you don't have to like tape things to this bed rail to prop things up anymore and get rid of that adhesive residue, which can harbor infection. Opens and expands over to the bed rail. I could even do it one-handed and then it stays in place. So what can you use it for, right? Well, number one, don't you think you'd want to keep your patient's call light within reach? Okay, why? Why? I mean, like, why would I even have to ask this question? But like, I feel like you have to explain to administration why. Well, so the patients can call you if they need anything, and so they don't have to sit there in pain, so they don't have to go to the bathroom and can't get help, because otherwise, you know what some of our patients do? They get up out of the bed by themselves and they could fall. Okay, I hate saying it like this, like it's so stupidly obvious, okay? And now I'm gonna show you some things that might fall to the floor, right? We toss the blood pressure cuff over usually, that could fall to the floor. How many times do we wash that after it hits the floor? That's correct, never. I'm just saying, I'm just being honest. I remember in nursing school, they said if our bed sheet, when making a new bed, if a corner touched the floor, we had to start over and toss that sheet. Okay, do you think nurses have time for that? We're already like short-staffed. Oh my word. Okay, here's a pulse ox. Has this ever landed on the floor? Or would it be nice to like unhook them so you can get them up to go to the bathroom and then rehook them? I don't know, I'm just saying, hey, it's right here. I mean, post-op vitals, patient back from post-op. What else do patients usually have? Oxygen. And we know not everybody needs oxygen. But you know, sometimes you just have it there, PRN, or especially the yonker. Oh, and how many times does the yonker hit the floor? I'm just saying. Okay, so now the patient can be a part of their own care. And now if you did have to walk the patient and monitor their blood pressure, their pulse ox, and the oxygen while they're walking, guess what happens? You can take this and put this on the IV pole, put it on the walker. Am I making sense here? Now the best part, maybe the best part, is if I was a patient, there's not much to do in the hospital. I could watch TV. Hopefully I'm using the power of mind to get better. But if not, my phone charger. Wouldn't it be nice if this was in reach? Wouldn't it be nice, you could put it right here in the same one as the call light, that I always know where it is, that you don't have to help me search for it. So these are just a few things. The IV tubing does fit through here, but you can use that at your own discretion. I think if you have a very alert patient that can participate in their care, sure, they can use it because they can monitor it. Or if you have a patient that's not moving at all, I would use it on them too. But otherwise, use your judgment, because you know, even as this is passive restrictive motion, it still could give it a little extra tug that for those sensitive lines, you guys know what I'm talking about. You're nurses. I'm a nurse. My mom's a nurse. That's why we invented this. All right. Thank you for getting out your notebooks and listening to me.